Insulin is considered the cornerstone of diabetes therapy, and to a certain extent that's true. Some people will, type 1 diabetes patients will die if they have no insulin, but the role of insulin in type 2 diabetes, in my opinion, is different. Let's start with pathophysiology. Hyperinsulinemia is considered as dangerous to a certain extent, and from that point of view, it's one might question why exogenous insulin would be beneficial for a patient. And in fact, there are no large controlled trials that show long-term benefits of insulin with hard outcomes in the same way as they are now demonstrated with, for example, GLP-1s or SGLT2. And we know from cohort studies, for example, the UK GP database, and also from Dutch cohort studies, that insulin might be, to a certain extent, might be not beneficial for patients. And of course you need also self-control, which is burdensome for patients. In that respect, I hope that that GLP-1s, which also injectables but without blood glucose self-monitoring and with hard outcome data, might take over the first place in type 2 diabetes instead of insulin. That might be a possibility. It's not yet true, but it could be the future. Yes, Edition Europe is a 3-country study in Denmark, UK and the Netherlands, in which we screen people for diabetes and afterwards started 2 treatments. The treatment according to the national guidelines and more intensified multifactorial treatment. So it's not a screening study, it's a study to see whether multifactorial treatment from the first beginning results in less complications, microvascular and macrovascular. And in 2011 we published the 5-year data, and we could demonstrate a 17% reduction in the primary endpoint was a composite of mortality and non-fatal stroke and non-fatal myocardial infarction. It was not significant, I think, to a large number of participants. We had 3,000 participants. Afterwards, when the trial ended, we followed them up, and on Friday during the EASD Congress we will demonstrate what happened 5 years later. So whether the beneficial effect of intensified treatment in the first years is prolonged, is sustainable over a longer period. Yeah? And also to see whether the very good levels of A1C, blood pressure and lipids are sustainable. We know all the graphs from the UKPDS in which from the first beginning A1C, both in the intensified group and in the control group, A1C levels rose, and in addition after 5 years A1C levels remained on average below 7, and it's very interesting to see what's happened after 10 years. And also the blood pressure decreased considerably, and we will see now what happened 5 years later, when people, some may have continued with the intensified treatment, others may not, but that's what we see, what happens in primary care setting when you treat patients at the very early stage of the disease. And Bill Herman, an American, he wrote in Diabetes Care in last year, he modeled the Edition data, and assuming that with our screening we detected diabetes 3 to 6 years earlier, he could demonstrate how beneficial that was, instead of waiting till people show up during the surgery and then are diagnosed with type 2 diabetes.